Now, ICU beds across the state are filling up quickly, especially right here in the Treasure Valley. The Idaho Department of Health and Welfare says Idaho has just about 130 open hospital beds statewide for patients needing intensive care. And this means that with our Nicole Camarda looking into where hospitals are standing, we'll find out what could happen moving forward.
Hospital ICUs are getting closer and closer to full capacity each day. St. Luke's in particular has 8 open ICU beds as of this morning in Boise, Meridian, and Nampa in total. And some of those beds are being reserved for patients coming out of urgent surgeries. But St. Luke's staff says the ability of the emergency department to provide critical care services is not a concern at all.
They are capable of performing the same type of care in the emergency department that they would receive in an intensive care unit. And it's just not where you would prefer to be on a longer term basis, but it's not a risk or it's not a lower level of care that they're receiving when they're in the emergency department.
While St. Luke's has capacity to offer care for patients in need, the strain is put on staff working long hours and picking up additional shifts. But what happens if hospitals hit full capacity?
You have West Valley, you have St. Al's, you have St. Luke's, all with multiple hospitals. And ultimately, what would happen is if one hospital truly didn't have any further capacity, they are going to be seeking out the other hospitals to say, we are full in this area, our ICU, our children's, or whatever area is at capacity. We transfer a patient to you, and then the other hospital will accept that transfer.
St. Alphonsus says they are in double digits when it comes to open ICU beds, and they also can offer care for all patients as of now. The health systems have been planning for the possibility of reaching capacity since April.
We've identified some space that might be considered soft space. It might not be hospital space at this moment, as well as units that are not occupied right now that we can re-equip and open up additional bed space.
Nicole Camarda, Idaho News 6.
St. Luke's staff says that they did reach capacity Monday night for available beds with available staffing, and they had to keep patients needing a bed in the emergency department overnight. The hospital says, though, this isn't normal, but it has happened before. The middle of the night is, as expected, a challenging time to discharge or transfer patients.